Madam Chair, members of the committee, my name is Grady Hanna, and I'm CEO of NightWare. I'm joined by Tom Burke, our company president. NightWare is it's a great Minnesota story. A brief overview. NightWare is an AI platform and digital therapeutic that is delivered through the Apple Watch that treats nightmare disorder, which is a key symptom of PTSD. So one of the major symptoms of PTSD is re-experiencing of events. And many people with PTSD, they're re-experiencing these events in the form of a nightmare. And so, for instance, we've received breakthrough status from the FDA because people with nightmare disorder are, depending on the study, are 3 to 5 times more likely to exhibit suicidal behavior. And so early on, we connected with a medical device expert who advised us to go the FDA-regulated route and seek a reimbursable route. Just one example of the rich ecosystem that we have in Minnesota. And so the way NightWare works is the wearer wears the watch, the sensors from the watch upload to our AI platform. That profiles and calculates a person's sleep. We can then detect when they're entering a nightmare, and we intervene through buzzing the watch to arouse them out of the nightmare without waking them. And we are in a randomized clinical trial at the Minneapolis VA. We are going to be submitting to the FDA for regulatory clearance in the next 90 days. Before I go further into NightWare, though, I'd like to just describe a bit of how I see the medical device and healthcare industry in Minnesota, not just locally, but nationally. So having grown up in Minnesota, I'm a proud Minnesotan. I actually participated in youth and government here, and I've always had a real respect for the Minnesota government as a means of supporting systems that help many people. And I believe that if you look as a cautionary tale, Minnesota used to be the world center for supercomputing. We were the big six. We were control data. We were Cray. And we got outpaced by Silicon Valley. And so now Silicon Valley is the center of computing and innovation. When you think of course, St. Jude and Medtronic and Guidant, which is now Boston Scientific, of course they're extremely successful, but they're almost monolithic because, as you've heard here with the organ transplant technology, it's extremely specialized and very rigorous in its review. And so we kind of just view it as it just kind of exists. But it's created this foundation for companies like NightWare. So in the case of Medical Alley, they proactively reached out to me. They have a means for startups to join free of charge. They reached out to me proactively, introduced me to my point of contact at the Minneapolis VA, who was responsible for us beginning our clinical trial, introduced us to our first lead investor, and continues to support us in multiple ways. And so when we think of the Minnesota as a national player with all the components we have with Mayo and the U of M and these huge players, I would just encourage you to realize that there's, and of course you do, but we have so many great pieces, and the more that we can cultivate that and create that and promote that capability, the better off we're going to be as a state economy. So in case, so kind of back to NightWare and nightmare disorder. A young man developed the kernel of NightWare while he was a senior at McAllister College. And I had lived 15 years out in San Francisco and had moved back, and I was interested in learning more about healthcare, and I read about him in the Star Tribune. His father had returned from Iraq with nightmare disorder and PTSD, and he invented this and was able to help his father and was promoting that fact, and I had learned about him. And so when I reached out to him, we were able to build a relationship and start the company together. And from there, we've built a robust AI platform that serves our veterans as well as other people with PTSD. And there is no current standard of care for nightmare disorder. So these are people that, in the case of PTSD, they can't even escape their demons in their sleep. And so it really puts them on the edge. And so to be able to treat these folks is really a privilege, and it's been an amazing journey thus far. people get very excited about the mission. So we've been able to recruit a senior management team, including Tom, and all people with extensive device and pharmaceutical experience. And there are 20 more people that have helped us in an ad hoc way, in a consultative way, that are local here in Minnesota. So once again, this long, rich history of more of the interventional care, right? Heart valves and stents. That builds a foundation of rigor, an institutional foundation, so that digital therapeutics, which is now a regulatory category within the FDA, we have a foundation to build on, along with many other modes of healthcare delivery. And so in terms of, there's a significant market. It's really kind of a misunderstood and poorly diagnosed condition. That there's a significant market opportunity, an opportunity to bring jobs and care to our citizenry. We're in a randomized clinical trial. We've been able to show efficacy and safety. We have a site here at the Minneapolis VA, and we're actually adding the Tampa VA, and are in discussions to work with Wounded Warrior as well. We've got a full commercialization plan, and our use of funds, because of the talent base in Minnesota and the fact that the cost of living is so reasonable compared to the coasts, we've been able to get to this point where we're 90 days from FDA regulatory submission for just over $1 million. So it's a very different profile than maybe what we're used to hearing about medical device. And it gives us the opportunity to leverage the talent here in all kinds of ways, and people that are investors that are savvy. So things like the investment, the angel tax credit, things like that really do make a difference. Pat Dillon with the SBIR does fantastic work reaching out to startup companies as well. So NightWare is an AI platform, a software platform that's regulated and reimbursed as a device. So we're really at this neat, innovative intersection of where value-based care is going. And we couldn't be doing it in a better place. All things being equal, if the costs were the same in any place else in the country, I'd rather be building this company here. And so I want to thank you, Madam Chair and Committee, for your time. And thank you for indulging me on my love for Minnesota and where I see this very important industry to our state's mind share nationally. People know Minnesota, but I think we can build on that narrative and really become more robust in how we promote Minnesota as a great state for healthcare and medical device delivery. And I think that the Medical Alley Group is doing a great job of that.
Thank you, Mr. Hanna. Senator Hayden.
Thank you, Madam Chair. Mr. Hanna, just a little bit about I don't want to get too far in the weeds, and don't tell me things you can't tell me, but is it, how does it work? I mean, I know it shoots something up to your AI platform and then back and then gently wakes people up or makes something happen to where they stop having their nightmare, but is that based on movement, or is it based on heart rate, or how does, in a very basic way, how does the device know that you're falling into a nightmare?
Sure, Madam Chair, Senator. Those are the two main components, are heart rate and movement at this point. In choosing off-the-shelf technology, consumer off-the-shelf technology, we're able to utilize Apple's innovation curve. So body temperature, galvanic skin response, additional sensors as they come available will be instructive to our algorithm for this disease state and others. At this point, we're able to get a strong enough signal in the rapid change in heart rate associated with the nightmare and the movement associated, because more trauma-induced nightmares, people are no longer paralytic. They move, they thrash, they reenact the dreams, the sequences. And so we're able to get very, very good and strong signal through heart rate and movement at this point. And I do want to add,
Mr. Hanna.
Excuse me, Madam Chair. The Minnesota Department of Veteran Affairs support our troops program. We applied for and received a $100,000 grant from them. That was another key component of us being able to move forward with non-dilutive capital as we develop out our therapeutic.
Thank you. And we talk about mental health on this committee a lot, and especially veterans' mental health. And this is something that I hadn't ever heard of. And that it's coming to market this quickly, or not coming to market, but that you're getting it through the FDA process and a non-pharmaceutical way to help veterans and others with PTSD. Do you know, is this a device they would have to wear the rest of their lives, or are they actually being retrained to not have nightmares so that they can have steady state sleep?
Madam Chair, at this point, we don't have enough data to know whether we can change core brain function. What we find is that if somebody's utilizing NightWare for a period of time, and say they go on vacation or they don't utilize it for a few days, that for about a week, they're not experiencing the same level of nightmares, and then they do come back. Our hope is that after 3 to 5 years of data, we can see a change to their core brain function and their incidence of nightmares, and that's all biometric information that we're collecting along the way. In regards to mental health writ large, Learn to Live, Habit Aware, there are many great device and cognitive behavioral therapy companies focused on mental health, and there is, in general, Minnesota is a very proactive state around mental health, and so it's a great environment through the Manova Conference, through what NPR is doing with their mental health series. There are a lot of forums to discuss these types of issues, and